Tonight, and on behalf of our other co-hosts, we have Pop Guy from InterHealth. Pop, where are you? We have Jim Campbell and the WHO team, and the Health Workforce Group. A big hand for them because we have our colleagues from Women in Global Health. Thank you, Rupa, for moderating tonight. And of course, we have Seed Global Health, Dr. Vanessa Carey, who will come up here shortly. So, here's the run of show for tonight. We're going to spend about a half hour hearing from extraordinary leaders, those who have worked at country level. You have a former president, Nobel Peace Prize winner, who is now the new WHO ambassador for Health Workforce, the first. And we'll have global perspective from Jim. Rupa will moderate. That will be about a half hour, and then we're going to open it up for networking. So we hope you'll hang around. About 7:20 or so, 7:25, we'll open up for networking. So let me start by talking about something I think we all deeply believe, which are the values of health workers represent some of humanity's most sacred. I recently asked a number of health workers I work with why they do what they do. And here's what they said. I do this to awaken the conscience of the world. I feel fulfilled by serving the poor. This job lets me save for my daughter's education. I refuse to accept poor care for poor people. I love my community, and my community loves me. These are the words of Tigist, of Ruth, of Emmanuel, of Serena, and of Alberta. Nurses, midwives, and community health workers that my team at Last Mile Health and our Ministry of Health partners have served alongside in the world's most remote communities. These are their words. These are the reasons why they do what they do. These are their values. We invest in what we value, and we value what we invest in. When I look around this room, I see a number of people here who have themselves shared values with workers like this. Some of you have even been health workers. How many of you have been a health worker before in your career? Great, great. Do you remember how good it feels to give care to another human being? Do you remember why you chose to serve? We're proud to co-host this session, Investing in Health Workers. Tonight, you're going to hear some things that might surprise you. We will hear that the poorest women in the world subsidize global health to the tune of over $1 trillion of unpaid work. But we will also learn how 194 countries made a bold commitment yesterday to the rights of workers to be paid and contracted in the first ever WHO resolution on community health workers. Tonight we will affirm that health workers are not a cost but an investment in our future. Tonight we will hear about the fact that we face the largest health worker shortage in history. 18 million health worker shortfall if we do nothing different. But we will also learn how extraordinary leaders on this panel are closing this gap by investing in teams of frontline health workers to create thousands of jobs and bring primary health care within reach of every last child and family. We invest in what we value, and we value what we invest in. So while we all listen tonight, we hope you'll reflect on the values of health workers. We hope you'll reflect on why they do what they do. We're hosting this on occasion of Dr. Tedros naming Her Excellency President Ellen Johnson Sirleaf as our new WHO Goodwill Ambassador for Health Workers. We thank you, Madam President, for your leadership, not only now, but we all remember your engagement and your leadership when the Ebola epidemic hit us in West Africa. We remember how you stood up to invest in health workers during the crisis and after the crisis. In fact, one of those health workers that benefited from Madam President's leadership is here with us tonight. Where's Alberta Freeman? Can you stand up? Alberta is part of the government of Liberia's National Community Health Assistant Program, which Minister Wilhelmina Jala, Honorable Minister Jala, who's on the panel tonight, and Dr. Francis Kate, our CM Chief Medical Officer, run today. And she left us with this promise, a challenge a couple of days ago. Some of you may have been in that session. I want to repeat it tonight. Alberta said, if you promise to invest in health workers, I can promise to continue the fight on the front lines. So we hope you leave tonight feeling just a little more inspired to keep that promise, to keep Alberta's promise. With that, I'm going to introduce my dear friend, Dr. Vanessa Carey. Vanessa is the